The advantage of that is you probably don't love this little extra lax tissue. No. It's a tummy tuck on a guy.
How many surgeries to reconstruct your face?
I've had 7.
What'd you do about food?
I had a feeding tube.
For how long did you have that feeding tube? For
a year, yeah.
Let me ask you a question. When you look in the mirror and you say, this 1 or 2 things bothers me the most, that you wish you could just make go away.
My eye.
What about your eye?
I don't have 2 of the same eye.
You have a little unevenness between the eyes?
Yeah. And then they did do a nose surgery. Just the scar tissue on the right side is just really a lot of scar tissue in there. Like if I had to rely on it to breathe, I'd suffocate. And
so you have right nasal airway obstruction.
Yeah.
Could you just tell me a little bit about this emotional journey? Because your mom, who you love more than anything in the world, has a major injury, could have died. She comes home, and what was that like?
I really just don't remember.
You don't remember what?
The details of, like, what I did on a daily basis.
Did you know that? This is the first time you're hearing that she's blocking out this whole traumatic incident? How do you feel about that?
Not good.
It's been hard, but it's more important to me that my mom doesn't see herself as a monster anymore. My mom is my hero.
Before my surgery, my face was destroyed by a motorcycle accident. I had a disfigured left eye and mouth. I also couldn't breathe due to my right nostril being closed off from all the scar tissue. I hated what I saw in the mirror, and I hated what it did to me and my family. But now, thanks to Dr. Nassif, I can breathe. My eyes are more symmetrical, and I can finally look in the mirror and not hate what's looking back at me. I'm excited about life for the first time in a very long, long time.
I want you to bring me a bikini, and we're gonna mark the top of the bikini in pre-op. And if you don't have a belly button in there, gotta try to make you one out of some scar. Not easy to do. This is complicated, fixing this. That exact complication that happened to you could happen to us. Dying, infection, the whole thing. Because now I have beaten up, damaged tissue. I have a special consent form that I have patients in your category sign called high risk consent, which says, besides all of those scary forms you just signed, oh, this is a little different. Oh, what do you think?
I'm just nervous now that you're saying it's a high-risk surgery.
Scary stuff, my dear.
It scares me that I may go through this all over again. But there's a risk in any surgery, so it's just having trust in your doctor, and I have lots of faith in Dr. Dubrow and Dr. Nassif. Before my surgery, I had no belly button and ugly scars going across and up my stomach that resembled Frankenstein. But now, thanks to Dr. Dubrow, my stomach is beautiful. He removed 2/3 of the vertical scar, so I'm able to wear high-cut bikinis, and it's not very visible. I'm completely in love with my belly button that Dr. Dubrow created. It's something that I didn't know was possible. Rest in peace, old belly button.
The question is, what's missing? So basically, you have some remnant of muscle here. You have nothing right here. It's pure skin graft on bone. You have some remnants of soft tissue here. Another option is to make an incision across your entire abdominal wall, extending into the unaffected right side. It'll have a better shot at matching the left side.
Right.
The advantage of that is you probably don't love this little extra lax tissue. No. It's a tummy tuck on a guy.
Okay.
Big downside is complications. I mean, there's a big difference between working on this smaller area, although substantial area, than lifting everything up, doing a full tummy tuck. But I'm willing to go after it, if you're willing to go after it. If you want to do the whole thing,
yeah,
I'm there for you. I'll do the whole thing.
I think the best option sounds like, you know, even though it's a bigger risk, probably do the whole thing and try to make it look as symmetric as we can.
Before my surgery, there was a big gaping hole in my side. But now, thanks to Dr. Dubrow, the hole is gone. I have symmetry, and I'm no longer in pain when my work belt rubs against my side or anything. There's no way you could possibly tell what my side looked like before. I'm back to dating again, and it just feels amazing.
I had a fever, so I was going to the pharmacy to get medicine. As I was driving, I sort of passed out. I drove into a steel fence. I woke up, blood was gushing out. I figured out, crap, I've had an accident. There wasn't a plastic surgeon in the hospital, so just a normal doctor stitched it up.
So it was an emergency room doctor, really, right?
Yes.
The emergency room physician was more interested in saving George's life than making his forehead look as cosmetically acceptable as possible. And that's where he should be.
When the scab fell off, that's when I realized there's a gap in between my eyebrows, that I have 3 eyebrows, and that this half of the eyebrow is halfway in the middle of my forehead.
You had this 3 years ago. Out of curiosity, how come you haven't had this fixed yet?
Well, the doctor said for the first year I can't touch it until it heals 100%, and my daughter's 1. I want to fix it before she gets older.
So she says, Dad, what happened to your eyebrow?
Yes, exactly. She still sort of points to it and touches it. Yo. Yes,
Hey.
What's up? What's up? Good. Good. Let me see you.
Hey.
Wow.
Hey. Hey. Oh my goodness. Oh.
What do you think, Mom?
Oh, this is...
Be gentle, Mom. You're going to break it again. Before my surgery with Dr. Nassif, I felt like the poster child of what happens to you when you don't wear a helmet. My left eyebrow was in 2 pieces, and I felt really uncomfortable wherever I went. Now, since my surgery with Dr. Nassif, I finally have just 2 eyebrows. And I don't have to remember my nearly fatal accident every time I look in the mirror.
When I was about 14 or 15, I fell off my bike, straight into the curb.
Ouch.
And was your nose crooked?
The wee bit here, yeah. And then I started to snore and having breathing problems. And then I went to a surgeon. I was about 18, I think. He said to me that he thought my nose was very manly and he could define it and, you know, give me like this lovely nose.
And
so
he suggested these changes.
He said this to me.
You walked into this plastic surgeon's office with complaints of breathing.
Yep. He says he thought that he could fix my nose.
A red flag.
When my plaster came off, I actually was happy enough with it. And the surgeon wasn't happy with it. I said my nostrils were too big and that he wanted to make them smaller.
That's twice.
Yeah, so again, I went with him.
How long was that between the first and second surgery?
I think it was about 1.5 years. When the surgery was finished, my nose was all pushed over and apparently it was like some sort of blood clot or hematoma or whatever.
On the skin or inside?
No, inside. But when he tried to fix it, when the plaster came off, there was no difference.
Well, I know it's affected her so much. She said to me, I feel deformed.
Wow.
I feel like a freak. All I do is think about what other people are thinking of me. I've been robbed of my confidence, my looks, and a wee bit of my personality.
You just wanted normal again.
Yeah, it would just really help my life, I think. Before my surgery, my nose was deformed and I felt like I looked like a freak. My nostrils were uneven, I couldn't breathe, and I felt extreme anxiety when I would meet new people. But now, thanks to Dr. Nassif, my nostrils are the same size, I can breathe properly, and my anxiety is gone.